All right. Well, let's just jump right in. Super happy to be partnering with Mike Lombardo and Elizabeth Estes, and we'll give Mike a chance to introduce himself here in just a moment. My name is Rich Knecht. I'm with the Integrated Human Services Group, and here in my capacities as an advisor to the Department of Social Services as well. We're going to talk about some key opportunities that are available to us in terms of prevention in California. And if you were with us in the session that we just concluded, we did kind of an overview to a lot of the various efforts that are available in terms of how to connect the dots around building a prevention continuum in and around your system of care. What we're going to do in this second session is dive deep on two areas. So there's tremendous opportunity in the school-centered arena, and two of those school efforts are worthy of a deep dive today. And so that's what Mike and Elizabeth and I are going to do. So super happy to have you with us. Mike, do you want to say hello?
Hello. Just kidding, Richie. Hello, everybody. Super good to be here. Welcome. I appreciate you taking a webinar in the late afternoon on a hot day, likely wherever you are in California. It's warmed up. My name is Mike with Lombardo. I'm an advisor to Health and Human Services, as well as counties and some school districts on integrated mental health services into schools, as well as build in integrated leadership team and ecosystem of care. Great to be here and partner with Richard.
Indeed, thanks, Mike. And you can see bios for Mike and I and Elizabeth in the run-up to the meeting if you'd like to see a little more depth there. And I'm sure when Elizabeth gets here to pick up some of the content, she can tell you a little bit more about who she is. But let's jump over and grab a little PowerPoint deck and jump into some of our early context setting and content. And we'll get ourselves started here. So we are, again, pleased to have you with us. We see some familiar faces and names. Happy to be in conversation with you for the next few minutes as we figure out how to identify where there's critical alignment in terms of the purpose and function between the comprehensive prevention plan work that so many of you are connected to, parallel to community schools work, and to the Children and Youth Behavioral Health Initiative efforts. So three critical areas of prevention that form your continuum. We hope you'll come away from today with an understanding about the key functions of the interagency collaboration that's present within Assembly Bill 2083 as kind of an architecture for holding those prevention efforts. More and more counties, fortunately, are kind of seeing this. And in fact, the state, in some of its policy, in some areas anyway, is beginning to encourage us to do likewise. So we're super encouraged by that effort. And we hope that really concretely, you'll also be able to identify at least four funding methodologies which can be shared between system of care partners specific to prevention efforts. So if you're with us in the prior session, I tried to tease you a little bit that you're going to get access to Mike and Elizabeth, who are experts in some areas where I have a little less understanding, but you'll get a little deeper exposure with this. So glad you're with us. We are going to look at this today. At the end, we're going to wind ourselves back up by looking at this through the lens of a fictional Jackson. So we wanted to introduce you to Jackson really quickly, who's a 10th grader with a learning and emotional set of challenges, who was adopted at an early age into foster care. And despite counseling and school support, Jackson's needs have escalated and leading ultimately to his arrest and temporary incarceration at the detention facility, over concerns for his family's safety. His adoptive mom has been caring for Jackson and three other adopted kids. They continue to seek appropriate services, including out-of-home residential placement, as the in-home supports were not provided to Jackson and his family in a timely way. So this is, we think, a vignette that's somewhat characteristic of what our experiences are for many kids and families around the state as they try to intervene with public systems that are sometimes difficult to navigate. Going to set some context here for a minute or two, and then Lydia is going to help us with a little Mentimeter to start a little bit of conversation with that fun little digital tool. But by way of kind of level setting, important, we think, to understand, really critical, that all prevention programs or models ultimately have the same goals. We're all here to keep kids at home, in school, away from youth justice systems. These also happen to be the big goals of system of care, right? So if you think about it, there's this organic nexus between the system of care effort, at least as it's found in literature, and what prevention is supposed to do. We don't always make this connection in California, but we're hopeful to move the needle a little bit with conversations like this one. In system of care in California, there is alignment of structure and a framework that has potential for sustaining prevention efforts way beyond what's mandated. So it takes a little bit extra effort, maybe not extra effort, maybe just extra awareness of how the system can be used beyond foster kids. Underneath the AB 2083 mandate, all system of care partners provide some forms of prevention. So this is a piece of awareness that's important. We all grow up in a silo, typically in this work, and we don't always see the prevention resources that our partners have on the table. And yet when we can figure that out, we can maximize impact. That's really the message. Underneath all of this is an awareness that if we do this well, that we're meeting the basic needs of kids. We try to remind ourselves everywhere we go that nearly every young person with complex needs was once a child with basic needs. And in California, in spite of efforts of throwing billions and billions of dollars into school systems and centers of wellness, our kids are still suffering. So somehow we're not maximizing this effort in spite of all the money. That's part of the dilemma, right? So here's some headlines. Amongst these critical prevention efforts, there are interdependencies. That is, the success of the prevention effort is contingent upon the success of parallel efforts. One won't succeed without the other. And the three places where this is most dynamic and present is between the AB 2083 Children's System of Care work, that's the job of your public partners in some key child serving departments and agencies, and the Children Youth Behavioral Health Initiative and the CCSPP, the California Community Schools grant funded services. So there's concrete interdependencies. We're going to call those out and talk to you about how you build and sustain those. Critically, awareness is present, I think, in the environment across the state that unless and until county agencies address longstanding programmatic and relationship disconnections in key areas, these efforts won't be effective or sustainable. Likewise, without the collaborative relationships and decision-making, the local programming and service enhancements that are features of school wellness, the larger system of care implementation is unlikely to result in desired student-level outcomes. In other words, you can spend all day building a system of care, but if you don't push the effects of that functionally with your dollars and your resources and your cross-training and your co-location and all those things that make for a good, mature system of care, if you don't do that in the service environment, like a community school, the system of care has little impact, right? So that's the interdependency. And again, we'll call these out in greater detail in just a moment or two. With that, Lydia is going to help us with a little Mentimeter. We'd love to get to know you a little bit more, so we're going to drop out of this environment and just invite you to Mentimeter in a second with 4 questions. I'm a member of my county's interagency leadership team, so if you're part of that AB 2083 effort, we would love to know if you're in the room with us. Maybe if you're not a member of it, but perhaps you've just heard about it, so tell us yes or no to that. And then 3rd question, some schools in my county have developed wellness centers or community school services, so if you have awareness that that's going on, we'd love to know about that. And then it's a little more technical and specific, but if you know whether your county, your local schools are using the fee schedule underneath CYBHI to bill Medicaid, we'd love to hear about that too. So I'm going to stop sharing and we'll go to a Mentimeter here, I think. Thanks, Lydia. Appreciate that. So there's some early outcome from our question. Thank you. Appreciate your early participation. Feel free to jump right in there and help us flesh out some detail here. This will help Mike and Elizabeth and I know a little bit more about maybe how to tailor some of our remarks. So we really do appreciate you jumping in. Is there a way, Lydia, to know how many respondents we've had so far?
I'm looking, sorry.
You're good.
Looks like we have about 6 or 7 folks that have answered.
Appreciate that. Thank you to those of you who have given us some context for who you are and what your awareness is. Okay, so we're look about half of you. Let's see, how do you answer? Lydia, can you orient us to the Mentimeter access? Did we drop that
Sure.
somewhere? Is it
So you're going to go to, and I'll add it here again, Eileen. You'll go to menti.com. You'll enter in the code, and then the question should pop up for you, and you'll be able to answer. And then we'll go to the next slide whenever we're ready with that. And
fantastic?
it will let you go to the next question. So I don't know if that's the issue or.
Yeah, we're waiting for the presenter to advance to the next slide.
Oh, so you all can't answer the question until Lydia goes forward. Oh, okay.
Yes.
Yeah.
Okay. Can we come back to the first question though in a minute?
Yeah, we can come back and look at
Okay,
everything.
great. Okay.
We'll
So
give
here's
people a minute.
beautiful. Here's the second question. I have heard about AB 2083 in my county, or what its intent is.
Richard, sorry, Richard, unless you're the owner of the Mentimeter and share the slides, it won't let us answer any questions because even though Lydia's on the second question, we are not seeing it on our side.
Thanks, Patty. Is there something I should do on my end, Lydia, for that?
I wonder if it might be because I can test it out, but I don't know if it's because it's yours.
Yes,
Yeah.
whoever set it up, whoever the owner of the Mentimeter is, has to launch Mentimeter in order for it to
Okay.
move on.
So let me go get the code. Appreciate the coaching.
Yeah, I wonder if I can just do a quick poll, if it won't take us too long.
Yeah. Thanks, Lydia.
So I'll just stop share for now and then we can come back to it. It'll pop up. Sorry about that. It's Mercury retrograde and I'm convinced it's really been messing with us today. So apologies.
All good. I'm going to drop the code in, and if I join, and if I go back to screen sharing, it should work.
Yeah, if you're the owner of the license and you're in there and launch it, it should work.
Okay.
So Richard, we're seeing your slides. We're not seeing the Mentimeter, but I noticed that you are signing in as a member rather than as the owner of the Mentimeter.
Okay. Well, that's a little bit beyond me. So we're going to help, Lydia's going to help us do a little poll here. Or you could all just throw up your hand and say, I am a member of my interagency leadership team. So put up your digital hand in the room and we'll take a quick scan environment of that. All right. I see a few. Fantastic. 1, 2, 3, maybe 4, 5. Excellent. Glad to have you with us. I see some names of folks in county land that are doing this kind of upstream system of care design work. So thank you for joining us. You've got expertise. Let's see. Give us the same response. If you have heard about AB 23 Children's System of Care, give us a thumbs up or a wave. So hopefully we're going to see a lot of the 69 folks joining us on that. So we hope it's not a secret that there are interagency leadership teams and system of care being designed in all 58 counties. Fantastic. Here's a poll.
Oh, the poll.
Thanks, Lydia. So resourceful and helpful. So if you want to jump into that and fill out the rest of this, some schools in my county, question 3, have developed wellness centers or community school services. And then question 4, some schools in my county are using the fee schedule for direct Medicaid access for mental health. We'll give you about 60 seconds so we can catch ourselves up. Appreciate your patience with our technology today. Thanks for the support and patience on that. All right, Lydia, whenever you're ready.
All right, I'll end the poll and then I'll share the results.
Fantastic. All right. Good, thank you. So about half the room, membership of an ILT. That's encouraging. And lots of you have heard about system of care, which is no small feat, right? Because 5 years ago, if we'd asked that question in a setting like this, we probably would have had a significantly different outcome. Appreciate that. And then question 3, 90% of us know of schools that are developing, school systems who are developing wellness centers or community schools. Superb. And some schools in my county, 70% of the time are tapping Medicaid. Mike, do those numbers resonate with you as what you're seeing from the CYBHI world?
I think so. Definitely over the last 4 years or so. Again, like you said earlier, if we tested this 5 years ago or more, we would have never, we would have very different outcomes.
Yeah, for sure. Fantastic. Appreciate that. Let me go back to a sharing environment now and turn it over to Mike to help us with a little more history here. So,
Okay, well, thank you all for your patience with technology. There you go. It happens. I want to talk a little bit about the history and those of you who've been around for a while know there's been numerous initiatives and reform regarding children's system of care or ecosystem of care, starting from the Little Hoover Commission in 1973, wraparound initiatives of 97, AB 3632, supporting school mental health or the integration of school mental health between SELPAs and county behavioral health departments, multi-tier systems of support, of course, trauma-informed justice detention, and many more. So we've been on a pathway and trajectory nationally as well as in California, a movement, if you will, towards an ecosystem of care with knowing that that's what it takes to create this hospitable environment for systems to work and for us to get strong outcomes for our children and families. Presently, there are still a number of reform movements, trauma screening, community schools, maybe among the biggest, high fidelity wraparounds, so a shift to high fidelity wraparounds. Family First Prevention Services Act is a fantastic opportunity to practice those muscles of collaboration. California Advance in Schools and school-based Medicaid as well as BHSA. And I would add to this list the Children Youth Behavioral Health Initiative. Richard had already talked about 2083 a little bit, but the movement continues. However, right now, I think we're in the best possible environment to transform each of your systems in each of your counties. Giving it a little more context. Oh, go ahead, Richard. We have the opportunity to really look at system change through these implementation factors because they're essentially identical. Across our systems, we're all working towards system change. And sometimes what I see as counties are gearing up their system of care or haven't got that far, people are working and doing individual efforts rather than combining the efforts, creating a more bigger opportunities for these to thrive. I'll call out the financial structures and strategies we are all struggling in each of our systems. But I think if we can work together in an integrated system, it creates the opportunity for us to be more resilient, pool our resources, use the best dollars in the best place at the most effective time. Whether we're a very small county or a large county, it provides for those opportunities to do that, as well as include in accountability, family choice, of course, collaboration with family voice. I'll call out an example where I saw this in action. I said this yesterday on a webinar, and Yolo County has truly embraced family voice and have a person with lived experience on their new reforming ILT team. And I observed a lot of respect for his opinions and deep listening. There wasn't the tokenism sometimes that we experience. Go ahead, Richard. So we're moving away from this on the left to this on the right. Historically, children and families, while at the center, had to go through multiple doorways of public health, behavioral health, juvenile justice, regional centers, education, human services, and we're probably missing a few. Often causing families not to get services or not be able to access what's available, moving towards an integrated system, a whole system, and a healing system where we, using the term differently than some of you are used to, but where we wrap around a family and support the family, keeping them at the center, working together for them. Different, maybe a little different than high fidelity wraparound services. Thank you, Richard.
Yeah, thanks, Mike. That integrated system is one where there authentically is no wrong door, or every door is a right door, right? And it's hard to get to. But just for a moment or two, one of our favorite slides when Mike and I talk about this, when Mike and Elizabeth and I talk about this, is that implementation can be complicated, right? And you have to pay attention to things at multiple levels. It's relatively easy, I will say, in my experience, for policy senior leadership to come together and gather around a table and say, we have a shared problem and we need to fix it. That happens all the time. We've been doing that for decades. And often the state will say, well, here's the funding stream. Or sometimes you'll go to your board of supervisors and you'll get dollars for it, right? That's that first level. Beyond that is where the work comes in, because at the management level, you have to help supervisors and managers understand the vision and how to figure out the complexity of the functional elements, the things you have to do differently to not only measure the key outcomes, use your data differently, but figure out how do we work together so that the vision takes form at multiple levels. And then further into practice, right? Like how do you make sure that case managers, therapists, nurses, interventionists in the field actually understand and transmit the vision, right? Taking that executive vision into community. So very complicated work. And to do that across multiple systems is super, super difficult. There is a body of research, in addition to the system of care research, which we may get a chance to talk about in a minute or two. It comes from collective impact writ large. So a lot of you know this already, but what we have failed to do in government most often is we haven't paid attention to three concurrent and dynamic interdependencies. A sharing of the vision, so getting that alignment, which is easy again, the structure to hold the vision and what the resources are going to be and how we blend and braid everything in the world that we have to do, not just the money, but the information, the training, the cross-training, the co-location, et cetera. Those functions have to be also held in highly collaborative environments. So function, structure, vision, all three have to be attended to at the same time in order to get the fullest impact. All right, with that, it's kind of all the context. Mike is going to take us on a deeper dive into why the school-based prevention has such focus for us going forward.
Okay, thanks so much, Richard. This has grown to be one of my most simple but favorite visuals. It's clear that prevention services serves and can serve more children and families at less cost. When we do this well, and when we set up a tiered system of support for our families and for our children, we end up benefiting more and expending less resources in a more timely, efficient, and effective way. Now, that being said, we often forget about focusing on prevention because we're really good firefighters. We're really good at sitting in the tier 3 in the most intensive, most critical students or children. When there's an imbalance in this and we have more children and families going into the intensive system, that causes a disruption and decrease of resources, a rippling effect, if you will, across our system where we're not able to afford or do anything really, really super well. So to create balance, we can't forget to look at the universal supports for children across all our systems, school, behavioral health, public health, etc., and be more efficient and effective in the use of those dollars. Okay, why schools? Many prevention COGS, I like Richard's term of COGS, now found in the school system. So I see some familiar faces here on the call, so you're well acquainted with these school strategies. In fact, in my time in schools over the last 15 years, I've seen opportunities or really a revolution, if you will, looking at integrated system structures for supporting the whole child. And we'll start with initiatives of multi-tiered system of support where we're identifying what can we do for all kids, some, and then a few intensive. This aligns really well with the last slide, but we know through a lot of evidence and research that if we can install MTSS, we right size that formula for supporting kids. If we can't install it well, my hand movements, we kind of create a funnel towards the deeper end of the system. So MTSS is critical to this transformation in schools and really across the whole system. We've seen lots of initiatives for wellness centers through BHSSA, BHSA, combining those with federally qualified health centers. Most places I go now, I see something that is along a journey towards a wellness center. This impacts the equity gap. By bringing services to where children are, they're more likely to use those services. When services are away from schools or away from being near schools, it becomes very, very difficult for a lot of our children to access those services. Families are working, families aren't available to drive, there's transportation issues. Whether I'm in a small county or the biggest county, the barriers are the same. So by using these centers of wellness and community schools, the next item on this, we're able to bring and surround services closer to children. I'm not saying that schools need to do these by themselves. We need to be operating in collaboration with our other systems. Then the funding levers of the LCAP, local control accountability plans, and the Children Youth Behavioral Health Initiative are making it easier for us to do that, or at least creating some funding opportunities to sustain these above strategies. Richard? The shared adaptive dilemma is really how do we build an ecosystem of care across all of our systems to include the school pathways and community school pathways? How do we use system of care partners to effectively recognize the opportunities? being in the same room and leveraging 2083 has created the ideal opportunity for us to do this transformation that I don't think we've ever seen, at least in my 20 some odd year history, to have a jumping off point where we've already agreed with MOUs. Now we want to realize the value of those MOUs and the integration. Richard. Thank you, Richard, for advancing all of these. So community schools, I was hoping Elizabeth would be here, but I will take these on and jump in, Richard, if you can.
Yeah.
So this is within the education systems, community schools has launched to help support the integrated efforts of this work, both in the academically rich environment as well as in our services to students and families in a more holistic way. Support them what their needs are, where they are, to work more closely with teachers, students, families in a more collaborative way, and really reaching out to partner with community-based agencies and local government. When I was with Placer County, I had a term sometimes. I'd say my job is to get across the sidewalk, because the sidewalk often is this artificial barrier between schools and community supports. Even in places where I literally saw the services across the sidewalk, we weren't integrating them into a community effort to support children. So this is our opportunity. In every one of your counties, there's a community school effort that now will be ongoing in the governor's budget. So it's just not collaboration or co-location or even wraparound. It's the deep integration of our efforts across all our systems, Richard. The California Community Schools Partnership, CCSPP. I'm not sure, but that might be one of the largest acronyms that we've launched, is driven by the California Department of Education and the California School Board. So I call this the other $4 billion investment on top of CYBHI. We've invested about 4.1, now probably more, well north of that, to support these efforts and give this opportunity to our communities. An important call out that I'm not seeing on the slide is that a key element of community schools is to work with and through a collaborative ecosystem structure. So get with me here. We had 2083 happening, or just happening, and transforming the use of ILTs. Now we've layered on community schools. That's what I mean by this ideal opportunity. So in all your counties, we have this chance to work more closely in school partnership. And frankly, there's funding to help do that. Richard?
Yeah, and here's that slide that gets to that structure piece, Mike.
Oh, yes. Do you want to take a shot at it, or you want me?
Here, yeah, I'll do my best Elizabeth impersonation here and just build on what Mike's suggesting, which is that if vision, structure, and function are all necessary to do good implementation, regardless of the effort, and community schools is one of those efforts, then the community school process has, as one of its pillars, an integrated interagency structure. It's a sharing of governance that leads to authentic community engagement and alignment integration, rich professional learning opportunities, the sharing of data, finances, et cetera. If you're familiar with 2083, as 80+% of you are, and you look at this center of this graph, this graphic, don't those 1, 2, 3, 4, 5, 6 things sound a lot like your MOU elements? That's by design. Right? That's the collective impact influencing multiple parallel efforts. So to reiterate what Mike said earlier, that ILT already has an environment. If it's doing its work, it's already creating the environment for successful community schools implementation at the local school site. Beginning to see the interdependence here, right? Like why we're talking about this in this environment. So we should be having Elizabeth join any moment now. And Elizabeth, if you are in the room, just let us know. We'll yield some time and space here, and we can certainly come back to a deeper orientation to community schools if necessary. But what let's do now, having talked about community schools a little bit, is invite Mike to talk to us a little bit about CYBHI in some detail.
Okay, thank you, Richard. I'd say CYBHI has been a large part of my work over this last 3 years. And here you go, the other $4+ billion initiative. These funds came from, when COVID happened, we all thought there would be an economic disaster, when in reality, there were more funds piped into the system, and the governor created a plan for youth, a redesign by using $4.5 billion to support children, youth, and families in the state through the Children and Youth Behavioral Health Initiative. We're going to center today mostly around how that operates directly in schools and the fee schedule. It's our opportunity to reimagine a more integrated system, or as Mike Lombardo just said, get across the sidewalk, to really look at whole systems for kids, promoting mental health, emotional support, and well-being for students, increase in access, because we know that services that are good in and around school are more equitable and more accessible. There's a mountain of evidence to show I am more likely to, one, access services, and then two, benefit from services if they're close to my environment where I spend much or most of my time, Richard. So the collective vision is really to support children and families knowing they're struggling, and knowing they're struggling even more now after COVID, or COVID highlighted that for us, to value the whole child in that through a center of equity. So we're starting to see this overlap again with community schools. CYBHI centered on equity, community schools centered on equity, our other systems through the ecosystem transformation also. So we can see the confluence of CYBHI, or the alignment with existing frameworks. Only a few are mentioned here, like MTSS, PBIS, community schools. We should have 2083 right below that. And that's why I said now is our opportunity to do this. Richard? Thank you. So this is my best shot at explaining a very complex topic in just a few minutes. The Children and Youth Behavioral Health Initiative multi-payer fee schedule work stream. So the state recognized through the legislature that schools were a place where children were getting these supports, but schools were not getting paid for the supports. Mainly the supports that our insurance providers should have been doing were being done in schools. For a lot of reasons, access is one of them. So the state initiated the multi-payer fee schedule through legislation, so that schools could be reimbursed for both Medi-Cal and commercially insured children under the age of 25, utilizing the folks who are still in place, thereby really increasing our workforce, for allowing people with pupil services, credentials, PPS, as well as psychologists, school counselors, are licensed people who operate in and around schools, and community-based agencies to bill on something called the fee schedule. It allows for large expansion of our workforce now through wellness coaches. So as of January 2025, wellness coaches are individuals who have an associate's degree or a bachelor's degree, who can now also bill and be reimbursed. When I say wellness coaches, think of um, family liaisons or advocates, family advocates. They go by a lot of names within the school structure system or your systems, but now we're able to build both of those funding sources, Richard. So it looks something like this. We can bill those services or get reimbursed rather, and becoming adverse to that word billing. We can get reimbursed for services that are both school linked or school based. So happening in and around schools or linked to school and a need that's been identified through the school system. Richard? When you think of the service provider array, this is a good visual to recognize that. The providers on the provider side, I want to point out again, we can get across the sidewalk, work with nonprofits, work with for-profit agencies, and in a few instances, in some of the counties I work, we're actually working with behavioral health agencies. So I'll say it again, behavioral health agencies from the county who are also eligible to be reimbursed on the fee schedule. So that just opened up what we traditionally in county behavioral health can serve, typically Medi-Cal eligible kids. So those individuals can work with kids by being made something called an affiliate provider. We also have our licensed staff and clinical staff who are either employed by the school or by providers. And then our non-licensed group, AOD, community health workers, and again, our wellness coaches. So this gives a snap or a picture of what we're able to do now in collaboration. Please note, though, that everybody must have an NPI number, whether it's the individual as well as the organization. And we can only be reimbursed for, well, let me rephrase that. Generally reimbursed for Medi-Cal eligible services, except for screening and maybe emergency services. So if you go to the link I showed previously, you can see the procedure codes for the oh, good. There's a question in the chat right now. As I was saying, look up the procedure codes at the CYBHI website, and it will show what the reimbursement rates are. Now it's different in schools than it is in your counties. You have each county might have a different reimbursement rate. For schools, it's a flat rate. And then those dollars can travel into the system unrestricted. So a lot of times, as we're doing these services in schools, like through LEA Medi-Cal, the funding comes back to schools, but in a more restricted way. Richard? So this is another way to look at the provider types. There's 4 provider types and generally 4 services that they can do. So you have your school-based licensed people, school-linked, PPS credential, and our wellness coaches now. The buckets, if you will, of services: psychoeducation, screen and assessment, therapy, care coordination. And I didn't see who posted that in the chat a minute ago, but if you click on this link, it'll take you to a PDF with the reimbursement rates. A news flash now, the reimbursement schedule has been updated to also include community health workers. So they're not on this slide, but they are now on the fee schedule. And I know many of your agencies employ people who are either called community health workers or have that community health worker role. Richard?
Thanks, Mike. This might be a good place to pause as we kind of wind up the overview to the fee schedule under CYBHI and take a couple questions from chat or others. So if you do have curiosities, you can drop them into chat or raise your hand. We're happy to have a conversation. There is a question, and we might need a little more curiosity from you. Your question around private insurance. can you say more about what you're asking about? Can that be part of the formulary? Is that what you're curious about?
I see. Maybe that was Barry. I saw his head nodded.
Well, it was,
So
yeah, go ahead.
private or commercial insurance is now legislative and mandated to be reimbursed. So, for instance, if my kids were still young and in school, we had commercial insurance through Kaiser Insurance Plan. What would happen is if they needed a school-based service, say care coordination or therapy, they can get that at the school. The school would generate a claim that goes through a third-party agency called Carillon. So get a picture of an hourglass. Carillon gets this claim and they go, oh, Kaiser Insurance. They send the bill to Kaiser. Kaiser sends it to the third-party agency and then back to the school. So Carillon operates as a gatekeeper for the numerous insurance plans and managed care plans across the state, a funnel, if you will. But it allows for reimbursement for both commercial and Medi-Cal kids. There's a few exceptions for that. That's why it's called the multi-payer fee schedule, but I won't. We'll do a deeper dive. Email me and we can get into what the exceptions are.
Thanks, Mike. One other question, Virginia, thank you. What would be the route to becoming an affiliate provider? Did we answer that, or do you want to elaborate further on how to become a provider under the fee schedule?
Sure. Once we start the next section, I will grab the link to how to become an affiliated provider. But the most important thing to know is the LEA or the district has to designate you an affiliate provider. So if we're here in Placer County and we have the Lighthouse Counseling Service, the school, Roseville City School District would have to say, we want a contract with the Lighthouse to become affiliate provider with us. That's the simple version. There's a couple types of affiliate providers. I'm going to throw it in the chat next. And then as you read it and maybe get confused, reach out to me and I'll help explain.
Mike, thanks. Any other questions around the fee schedule? I see chat opening up again. Okay, good. Thanks. Lisa, saw your question. Thanks for joining us today. And looks like we answered that. And so we're at a transition point, which is great timing to reconnect and introduce Elizabeth because she's joined us now. Elizabeth, do you want to say hello?
Hi, everybody. I just got off a HIPAA FERPA training where we were talking a lot about affiliate providers under the fee schedule and whether they were governed under HIPAA or FERPA. So to Mike's point, you will get confused when you read it, but call him. So there you go.
It's what government does best. We confuse people.
But there is an expansion here. You can become a provider. Mike, correct me if I'm wrong, but I don't think I am. It doesn't have to be your local LEA, school district, or county office of ed that taps you and puts you in their network, right? They don't have to be in your region.
Yeah, so there's one other caveat that you could become if you work in 2 or more counties, but you must have a brick and mortar building someplace in California. Under Medi-Cal, you could become what's called a statewide affiliate. So we'll see Seneca, for instance, Wellness Together, Effective School Solutions becoming statewide affiliates. So they work in multiple counties. You do, or what I advise schools to do, is to still create a contract with those folks because there's some legal ramifications for schools that Elizabeth and I drone on about for days or on weekends and Saturday mornings. That's how we spend our time. So expect a contract, but you can become a statewide affiliate as well.
All right, fantastic. Elizabeth, at the start, we referred folks to our bios that they got in advance. Do you want to tell folks just a split second about you and how you got to this conversation?
Sure. I am a career lawyer in the children's system in California. First, I represented dependent delinquent minors and then started representing the California public school districts to provide the most effective, robust services we can for the children of California. And then I realized that the systems needed to be integrated in order for us to best serve the whole child. And we needed to figure out how to unite across our agencies and communities. So Breaking Barriers was launched 10 years ago. And I have been running that ever since while I've been practicing as a lawyer. And now I'm directing that. So happy to be here. I met Richard and Mike in my journey to create the most effective whole child system we can for children in a prevention model. So happy to be here and help in any way I can. And yes, Mike, we need contracts.
Fantastic. Thanks, Elizabeth, and appreciate the challenging calendar for you today. Appreciate you joining us. So we have now done a quick exposure to community schools, particularly with the grant-funded effort. Again, there are community schools outside of that grant, but the grant is a unique opportunity that's really well endowed. We've done a quick overview to CYVHI and the fee schedule. So we got these two kind of interrelated prevention, early intervention efforts designed to help kids and families be together, safe, at home, in school, right? And what we want to talk about now is what's the system of care's relationship relative to providing a structure through which those two things and others like them can be sustainably implemented. And I'm going to do that pretty quickly. And then Elizabeth's going to do kind of a deeper exploration on what are some organic kind of interdependencies between those efforts, those two efforts, the fee schedule and school wellness, and the system of care and how they relate to one another. I hope that makes sense. So this is where we're going to kind of tie these three things together a little bit. So acknowledging that most of you are somewhat familiar with system of care, here's the definition that comes out of the literature, right? Lots of nice words. It probably looks a lot like your vision or mission statement in your 2083 MOU, or maybe even your department or agency vision statement, right? Some similar language. And what I try to remind myself of is that it's lots more easy for me to remember that system of care as organizations and people sharing the 4 R's: responsibility, resources, risk, and reward. And I want to celebrate y'all because I've had a moment of awareness after all these years of talking about the 4 R's of system of care that there's actually a 5th R that I've been missing all along. We haven't been missing it. We talk about it all the time, but it should go in the formula, which is relationships, right? Because I read a couple of monographs recently. I'll pontificate for a second and digress for a second, that talk about the reality that we have put lots of resources, supports, services, and interventions into the right environments, and we often still don't get impact. And it's because often those interventions don't successfully reconnect kids with their natural communities, right? Like we're not really doing effective work, even though we're implementing evidence-based programs, because we fall short of reconnecting kids with their kin and their natural supports and the environments where they can get well sustainably, right? So what I'm going to do, so my homework, I already made a note. I'm going to go back to this slide and change it in all of my decks to say it's a sharing of responsibility, resources, risk, reward, and relationships. There's a 5th R, and I just want to acknowledge that. Each of the states, 58 counties, has a memorandum now with an interagency leadership team. Talks about how we're going to blend all sorts of stuff: information, data, people, training, other resources, buildings, facilities. Like, what are we going to share so that we can create the conditions for successful integration? The children's system of care is not an initiative. So if you think it's an initiative like every other, please, let's debunk that. It's a structured relationship that holds other initiatives. That's the one thing that makes it super different. It's anchored in an MOU. You may have other interagency bodies that talk about stuff, but none of them are collectively obligated to execute that MOU. And the system of care implementation should be about authentic partnership in support of students. Uniquely, California structured its system of care to include the County Office of Education. No other state has done that outside of maybe New Jersey or Texas. And so it's powerful that California has the County Office of Ed as a mandated partner. Please know that there's some flaws in the 2083 architecture that are being addressed locally. One of those primarily is the population of focus is identified as foster youth who've been traumatized. And what we want to acknowledge is, and many other counties now, I got to update this slide too, the population of focus has been enhanced to be much broader than that. So young people who are at risk of entry or who are vulnerable, right? And many of you are in counties where those MOUs have been already transformed. That memorandum of understanding has to include critical things like what's the leadership team going to do? How often are they going to meet? How do you support that? What's the practice model mean to us in our county in terms of integrated core practice and how we actually team and understand the needs of kids and students? How we'll use the interagency placement committee, which is honestly ideally situated in a place where schools and regional center partners could benefit, but we don't do that very well. We typically see IPC as only a court kid related process, but it can be way more than that. The MOU has to address effective assessment, screening, and entry to care, teaming in all of its forms, the coordination of care, including things like Every Student Succeeds Act and the McKinney-Vento work, right? So there's a place in the MOU for basically everything that we're all mutually obligated to. Now, those obligations are distinctly held. Some responsibilities are higher or bigger in some places, but in a mature system of care, nobody's job is to be on an island. Our job is to get everybody off the island into collective impact. Really quickly, a look at the interagency leadership team, whose job is to set the vision and the strategy, to identify the opportunities, to engage with electeds, to make sure that operational agreement is effective. And then in most county systems now where this has been implemented effectively, there's an advisory team or an executive advisory committee of deputies or senior managers, and those folks take their direction from the ILT, and their job is to figure out, well, what are the barriers to implementation of that vision? How do we review the policies and procedures and begin to implement in a meaningful way? How do we carry out the directives, right? And how are we going to measure impact? So let's begin talking about impact and outcomes. And so at that level, we would begin to think about what's a dashboard look like for our impact and for our work together, right? So that's a quick look at just the processes and the functions of good work. Here's a quick graphic. This is a sample, what we might characterize as a sample children's system of care structure. We talked about structure, vision, and function at the outset. This is the structure that holds those functions across the initiatives. And when we talk about system of care not being an initiative, that's what makes this different, is that you see all these initiatives at the bottom, things like the fee schedule, school wellness work, which is what we're talking about today, community schools, talking about that today, prevention, comprehensive prevention plan, talking about that today. We haven't talked much about the BHSA integrated plan or high fidelity wraparound, but there are a half dozen others. Reform opportunities, mandates, initiatives, issues that come up that could be centered within the system and that would be magnified by being held across the system. A couple more slides to orient us to system of care, and then we'll transition to Elizabeth's work here on identifying the interdependencies. We love this slide because it highlights what, you heard Mike mention at the outset, what he calls the hospitable conditions. What a good interagency leadership process looks like is it creates over time, when people are consistent in their commitments, we create these hospitable conditions for how do we share information. In other words, how do we mitigate things like HIPAA and FERPA so that we can actually share information in a timely way? How do we create the fiscal maximization so that we draw down a full complement of Medicaid or 4E revenues, right? Because all federal dollars require a match on some level. And we got to figure out how to match them. And we don't do that very well in California. We've been sued at least twice because we didn't do that very well. So that's a big piece of it, right? How do we cross-train? How do we co-locate? If you do everything there on the left in that kind of taupey, tan-colored box, then we set the conditions, the environmental, ecological conditions across the ecosystem for implementation of whatever initiative, including today's conversation, community schools, and the fee schedule. So system of care is the container for the implementation process. And when we do it well, here's some of the research that says, if you're successful at that, you're going to get all sorts of good stuff. This is a short, abbreviated list of where the impact is. So we get decreased behavioral and emotional problems, less suicide attempts, and less substance use. There's less caregiver strain. We get critically an expanded array of services. Sometimes we look to government to give us more money to fund new programs. when in fact, if we were just in a way we could collaborate the resources we do have, we could actually develop capacity. And systems of care all over the country have done that for decades. By bringing their dollars into alignment, they discover they got more money than they realized, and they can build new programs. So they can expand their array of services. We see things like increased school attendance, less expulsion, suspension, less dependence on inpatient services, better graduation, less involvement with the youth correction system. So again, it's just a short list of the outcomes. It's important to understand, these don't come with more money. These come by doing the integration work. Because in most of the systems of care that were studied across the country over the last 40 years, they haven't had more money to associate with these programs. They simply did the deep work of collaborative process. Okay, so we're now fully grounded in the fee schedule, CYBHI, community schools, and systems of care. And we're going to invite Elizabeth to orient us to some of the interdependencies of the stuff.
Okay, great. Thank you so much. And sorry, I couldn't be here the whole time. I want to talk about the interdependencies here. And I just saw in the chat someone say, that we're more efficient with our available resources if we unite those resources, and nothing could be further from the truth. And I started talking about this because we don't have shared leadership across our agencies. So what I was seeing in the field, and my expertise was complex youth in our schools, was a kicking of the can across agencies for students that were eligible for services and supports from various agencies simultaneously, but the agencies didn't work together. And so there was this like, no, you do it, no, you do it, no, you do it. And then the youth doesn't get what they need when they need it. And that's really what got me leaning into integration and the development of breaking barriers, and the recognition of what we're talking about here today, which is that system of care, while initially intended for foster youth, can be expanded in our California counties to provide structures for interagency work for the whole child, for all children. And so we've really been leaning into that, and it's been great. The implementation interdependence one that we wanted to talk about, that exists in community schools. It exists in, I wouldn't just say fee schedule, but CYBHI implementation as well as system of care, is shared leadership. We need shared leadership teams in our counties and communities that are uniting one another across our agencies to best maximize utilization of our resources and achieve the goals we want for children and youth and families, and frankly, those who are serving and supporting them. So consistent alignment of vision and consistent communication, attendance at advisory team or ILT meetings, building relationships beyond those required under AB 2083, engaging your county Office of Ed system leaders and understanding that our relationships will provide coherence even when money cannot. And what we found, we're running a Transforming Together project for CYBHI right now, which is 4 pilot counties working on this. And what we're finding is that if they unite their resources, what they are telling us is they're more efficient in serving students, and they're able to address duplication of services and make those services more efficient and more accessible to kids, because otherwise agencies don't know what the other agencies' resources are if we aren't in a collective body of work together. They do not know what they are, and I know this because I spent decades on the ground in those meetings. Next slide. Information and data sharing is critical to all of this. We have to have united information and data sharing processes. And when I talk about this, I'll just tell you, I talk about macro information sharing, so de-identified information sharing, so that we can build shared dashboards and outcomes and measure them and hold ourselves accountable to them and develop them with our counties and communities. And in addition, micro identifiable information sharing, which means case information for students, so that they don't have to tell their stories over and over again, so that children and youth can give us the information, and we can share necessary information in order to both care coordinate for them, well, I would say by, for, and with them, and make sure that we're maximizing their access to services that they're entitled to. So a community school is designed for that. And it is at the local level, a place where we should be able to pull from a universal array of services that identifies all of the services and supports students and children and youth are entitled to. But in order for a care navigator at a community school to be able to pull from that universal array, we have to have united across agencies to identify what that array of services is, so that, and make it transparent so that everyone, care navigators who are trying to navigate for them, as well as families and youth and children, can access those services. And this is all going to be facilitated by information and data sharing. Care coordination and uniform service planning goes hand in hand with information sharing. If we identify the services and support students are eligible for and are accessible to them at the local level, then we need care coordination and uniform service planning. CFPIC, I don't know if you guys talked about it, has built a really interesting tool, at least for me, where we can input a student and up pops the entitlements that they hold and the agencies responsible for those entitlements. It would be fantastic if care navigators were able to put information regarding a particular youth in a database, and then out pops the information related to the care coordination and uniform service planning for them, and have the relationships with the other agency representatives so that they can coordinate that care and get that care to minors. We've been doing forums on this out in the field, and it's been fascinating to watch the care navigators on the ground say, you know, Johnny can't get, I just remember one of the forums we were in, they were like, glasses, we're having a really hard time getting glasses. But the representatives from the county ILT were there and said, wait a second, like, we have access to that in a totally separate agency, because that was education. And they said, oh, let's work together. We'll figure out how to get them those. These are the types of forums that we have to have at the local level, both at the county level and down at the site level. And you have to have quality improvement and control and reciprocal accountability processes there too. Next slide. Financial and resource planning for stability is critical. Right now, we need to maximize our resources, and I mean human and fiscal, and we can do that. But we've got to look at the available financial resources that we have and human resources that we have, and the universal array that we want to be able to offer that's the most robust at the local level, and then plan for sustainability. It is a major challenge for children and youth and those serving them when we develop programming for them that then we can't sustain. So really thinking about what is the sustainability of these services and supports is so critical. And the other thing that I'll just lean into here is we've encouraged people to slow down and not just say, okay, we're going to build and build and build because we got this new initiative or this new, but really think about how does that fit into your larger ecosystem build so that you can have the most robust array possible in a sustainable way for children and youth at the local level. And this can all be done, but it's very intentional work. And there are counties and communities doing it. Some of you sitting here.
Yeah, indeed. Thanks, Elizabeth. I'm looking at the clock and realizing we may or may not have time to do a deep dive on the little Jackson vignette because we've had a conversation. I want to get to a couple of the comments into chat as well. Patty, you had asked about where there are models of effectiveness. We're going to talk about in a couple of those in just a second. So thanks for that, Sharuk. Yeah, Mike's reflected on your comment about MCPs being partners. Appreciate your leaning in a couple of counties where a partnership is now connected to the system of care. There is we're not talking necessarily about CalAIM in this scenario, but but the managed care plans are executing whole person, no wrong door, closed loop care. It's essentially systemic, right? And so if you're going to sustain the CalAIM effort and close the gaps that are built into that bureaucracy of the carve out of Medicaid, you're going to have managed care plans in your ILT. So yes, we're going to get to some of those recommendations in just a second. I want to, let's finish up the slides because I think there's some important summary work in here, and then we'll come back to Jackson and talk about that a little bit as we go. We hit on this slide earlier, so we don't need to belabor it, but that's the outcome. Patty, to your question around some examples of where at least parts of the systemic work is happening successfully. Your county, of course, is a good example where you've done some just groundbreaking work on consistent leadership, an alignment of vision, which is not always necessarily visible yet on the ground in Santa Clara, big county, complicated place, but you at least have this super connected interagency leadership body. And for those of you who don't know, Patty's led the development of an executive advisory committee there that has been for at least a year and a half or 2 years now, co-facilitated by a person with lived experience, okay? Someone who went through the child welfare system. And she co-facilitates the System of Care Executive Advisory Committee. So some really great stuff happening in Santa Clara, Tuolumne, Sacramento, Ventura, Solano, Lassen. There are many examples. And what some of the common threads of those successes are mitigating the AB 2083 limitation on foster youth by expanding the population of focus. So inside that MOU iteration, the next time, and you don't have to wait. You don't have to wait for the state to tell you have to redo the MOU. You can do it anytime you want to. Go back to that MOU and get alignment amongst ILT partners and say, we're not just about the foster youth who've been traumatized. We are going to align ourselves and hold the responsibility for care and well-being for a much broader cohort of kids in our county, right? So that's step one. Relatedly close to that, you have to expand the ILT. If you're going to do step one, you got to do step two concurrently, which is go get your first 5 commission, your executive director, go get the managed care representatives, find your housing and homeless folks, find your judge, right? Get other key partners. Mindful here that you can't get too big or too broad because then you're going to lose the alignment, right? If you get beyond 8, 9 people in an interagency collaborative of any effort, it's tougher to hold the coherence. So be careful that you don't get too big with your ILT too fast, right? Not mandated under 2083, but create an outcomes monitoring system. So Tuolumne, Sacramento have these dashboards now that are in their early development. Tuolumne's is 2.5 years old, and they have a regular conversation now about what are the potential impacts across the system. Where do the investments of one partner have impact, good, bad, or indifferent on the other, right? So creating some kind of an outcomes assessment or performance management tool. Fourth key ingredient, in a lot of these counties, they have trained on some level to the integrated core practice model, which is that relational articulation of where and how and do we see families, right? Like where do we team effectively? How do we engage them with empathy and vulnerability, compassion, understanding? Because that's where real healing happens. All the systemic work is only to create the environment for healers to be healers. That's what it's about. So we violated one of the edicts of PowerPoint with so many words on this, so apologies for this, but we love the language that comes out of Sacramento. So I see a couple of Sacramento people in the room, or former Sacramento people. Notice the language here very specifically to prevention. So at the third paragraph, they call out the fact that structurally within their system of care now, the prevention cabinet and the child safety forward initiatives in Sacramento County are structurally and functionally located inside of the interagency leadership team. Now they're just deciding how this is going to manifest itself, but inside the MOU, they've got this clarity of vision that, okay, prevention belongs inside the system. So we're now going to bring ourselves into regular consideration of what prevention means vis-a-vis the system of care. Here's that expanded membership we talked about in the just prior slide, right? So I think this again comes from Sacramento's MOU. So you'll notice here, and sorry for the abbreviations, but Department of Family and Child Services Assistant Director. This is the second tier membership. This is at Executive Advisory Committee level or advisory team. And you'll see they're authoritative folks. So these are not supervisors or senior analysts. These are people with power in their departments. You'll notice public health is there. You'll notice that there's a connection to the interagency placement work going on, right? So this is older language, but notice also on the right-hand side that the first 5 executive director has a representative and others, right? And there's a process in Sacramento for the managed care plans to talk to the executive advisory committee on a quarterly basis now. So actually this comes from Santa Clara. Sorry, I'm talking about Sacramento, getting a little confused, but this is Santa Clara's language. So again, another good example of where there's prevention language and structure built into their system of care work. And here's some language out of Santa Clara's MOU. Thanks, Patty, for letting us borrow. But notice the powerful language here. Look at the third paragraph down. Central to its prevention approach is the county's comprehensive prevention plan. So right there in the MOU, Santa Clara has called out the CPP work that's the focus of our conversation in these prevention convenings, right? And how does the ILT relate to it? It serves not only as a governance responsibility, but helps build accountability for all partners within the system specific to prevention. All right, I think we got just a couple minutes, so we're going to bypass that. Anything on this slide that we think we want to emphasize? Want to leave 1 or 2 minutes just for final questions. All right. Really quick recommendations. We've talked about some of these already. Talk to your ILT people about what it would mean to put prevention inside the system, right? And to locate the community schools accountability and the fee schedule accountability. Like bring the partners who need to be in there on a rotating quarterly basis if they're not already seated members, and have them talk about those initiatives, right? Establish agreements that connect local schools to the ILT governance. So in a couple of systems of care we know about, they've created new seats in the ILT or the EAC specific to the school wellness work. So beyond foster youth, they went over to the county office and said, you need a second seat in this team. Alameda just did this, right? Okay, lots of other successful ingredients. It's complicated work. I think we've hit all those takeaways. I want to give it a moment or two. Let me try to get into chat to see if there's anything in there, or someone can call it out for me if there's questions that we haven't answered yet.
Richard, I just added that we're publishing the Transforming Together guide, which Richard and Mike have helped develop as well, where there are examples of people are asking about examples. We put in a number of examples about county builds, dashboards, MOUs, counties that have worked beyond 2083 to build out their ILT and their EAC. So
yeah,
there are a lot of expanding resources here that are being built.
And what's unique about that is you may be familiar with the system of care research nationally, but it's not applied to California, and California is way more complicated. So that guide that Elizabeth's referencing is going to be in some ways more practical potentially in California. Dennis, thank you. And I apologize when we were naming the ILT standing members. I think I left out regional centers, but obviously they are necessary. So good for you for that and for reminding us. Linda's asking, where will it be available, Elizabeth?
I put in the chat. It's in draft right now. It'll be out in its final in like June, but chapter 1 and 2 are there. That's draft. That's shared leadership and shared goals development. And the state is reviewing it all and will be publishing it all. But that you can go to the San Bernardino County Office of Ed Transforming Together website, and it's there, as well as some webinars. And one we just did, ASR was there. They're here today on the Sacramento dashboard that they built, and it's pretty incredible as a shared dashboard for outcomes for youth, and they're expanding and working on that now. So exciting work. And some of the MOUs and language that Richard just referenced are also there. And then I know Andrea and CFPIC have tons of materials too. So best we can to gather information about who's building and their successes.
Right on. Thank you for that.
Also,
Thank you for all. Go ahead, Mike.
sorry, Richard. I'll shout out that there's a webinar series.
Oh.
I can't believe Elizabeth forgot it. There's 2 sessions left. Each webinar mirrors one of the chapters. The one coming up is on April 14th and then May 4th, and you can register at the link I just put up in the chat, along with finding the first 2 chapters of the guide.
And the first 2 webinars are on that website too,
Yeah.
if you want to watch those. We've already done shared leadership, shared goals. We're moving into universal array design and workforce development, as well as shared financing, shared information, and quality improvement and control processes. So,
all right. With that, we are at time. Deep appreciation to you for joining us today. Mike, Elizabeth, thank you for joining the conversation. Thank you for your time today. Prevention inside the system is complicated work, but there are incredible opportunities if you'll make the investment and big payouts down the road. Always reminded that we're in some ways planting trees in the shade of which none of us will ever rest, but future generations of healers in your county will rest when you invest in system of care and ecosystem building. So thank you for that. And we'll catch you all down the road.
Allison Crawford.
Thank you so much, Richard, Michael, and Elizabeth, for your knowledge and expertise. This webinar will be available on the Strategies TA YouTube channel, as well as the Whova app. And there is a closing